can inject a venom or sting the venom to ourselves. Alright? So from 1 to 8, may I have some feedback? Which is the most common venom injected to our patient? In Malaysia? Jellyfish, yes, correct. Alright, so the most common is jellyfish, and then the less common is sea snake. Yeah? So we may have about 1 or 2 sea snake venom in a year, but we may have every month cases of jellyfish. Alright, do you have ever encountered a jellyfish? Who have an experience? Encountered? Nobody? Okay. Can we have a sharing a bit, 1 minute about your case?
That's my personal. I think I've been bitten once when I was maybe 5 or 6. So that was years old.
Alright. Where is it?
PD. Policer.
PD, policer. What happened?
I think it was very, very minor, very mild reaction to that. Just some itchiness. There wasn't at that time I can remember still there wasn't any need to go to see any doctors ke apa ke, tapi we know kita nampak jellyfish tahu bobo, what kind tu I tak tahu lah, we know it's bobo. I think this in swarms, so dia banyak bobo, tak masalah kecil pun. Because you see from above the water kita nampak dekat kawasan yang CT juga. But that was about it lah. I think other than that I just nampak masa kita contoh kita naik ferry because ke Langkawi ke mana tu, you can see. And then actually to treat someone when I was in NU last time, there was a diver lah who went, a military diver. I think it was about 1 week or few days after the incident. I think he went to diving in Sabah, but again it was a mild reaction that he brought back to his unit in Seremban. Again, tak ada nampak macam what we call it, like the skin reaction to it. So I think if I can still remember, I just managed with antihistamines lah masa tu, and didn't come back lah after that. So that was like 13 years ago, 2010.
Thank you very much. So you are from Ani?
I'm from
Lumo Hospital. Alright. Okay, so it's quite common, eh? Okay, so a piece of information that we have from the media. Okay, in 2000, there is a 26 years old Brunei, alright, tourist, have a sting in Pulau Pangkor. Alright, it caused death. The cause of death documented as an anaphylactic reaction. Alright. 2000. And then 2006, in Kota Kinabalu, 8-year-old South Korean girl had been sting in Pulau Sapi, next to the Kota Kinabalu. So it's about 15-minute boat ride, 10-minute boat ride. So however, collapsed and passed away also. Yeah, even though it's just near to the Queen Elizabeth Hospital. And then in 2010, this is a piece, Swedish female, alright, 45, swim at the beach in Langkawi, alright. And then a few minutes after that, collapse, bring to onshore, and then CPR commence, 50 minutes, paramedic declare death, alright. So this shows that jellyfish, yes, most of the time it causes itchiness and might be, but some of the jellyfish is dangerous. They cause life-threatening envenomation. Okay, next after that, in Kota Kinabalu, Kota Belud. Actually, Kota Belud is quite far from Kota Kinabalu. It's about 2 hours ride. Huh? So he also died after being stung by a jellyfish in Kota Belud. Right, this is the edition for Swedish tourists in Langkawi in 2018. Alright. Also CPR commenced by the family, but she succumbed to death. Alright. So to save life, we must have a knowledge, a bit of knowledge. To get a knowledge, we must do some research, and then spread the knowledge during the training, like this. Alright, this is from Philippines. Next to us, next to Sabah. 7-year-old also died because of possible due to multiple tentacle box jellyfish. Okay, 5 years old. Okay, next, this is also in Philippines, 2018. Alright, the little girls having stung by a box jellyfish also, that caused death. This is the lesion from the envenomation. Right, there is a multiple jellyfish that can cause injury, but the most important, we recognize what is the dangerous causing life-threatening or death. Okay, some I go through some of the anatomy of the jellyfish. The first one, bells and tentacles. So this is the dangerous part of these creatures, the animals. All right. So it contains nematocysts. All right. When being triggered, it releases the bug. All right. So it can sting the venom, toxin to the human or animals that we contact. Okay, this is how is it being activated. Tentacle being activated. Release venom. Alright, so let's we focus on this dangerous jellyfish, the small one, Urukanchi, and to the bigger, more than 10 cm, the box jellyfish. Alright, it can cause severe envenomation, systemic manifestation. Alright, other than that, Physalia. Alright, this is moderate size. Alright. Also, Malo species, so it cause Irukandji syndrome. Alright, so we should identify which is harmful and which is harmless jellyfish. Most of the harmful jellyfish is come from cubozone, and some also from the hydrozone and skipozone. This is a multi-tentacle box jellyfish, and this is single tentacle box jellyfish, very small, right? This is bigger. This is harmful jellyfish. Alright. From the jellyfish, Cnidaria, we class to 5, class 1 to class 5. That the most potential can cause death is the box, cubozone. Another Carukia Banisi is also under the class box jellyfish. However, it's a different family compared to the Chironex lacqueri, which is the Chirodrophida. Right? So it's the same class but a different family. This is that we are very particular of. Alright. For the hydrozoa Physamphalia, rarely seen, but however during the changing of the monsoon, we can have Physalia onshore of the east coast area of Malaysia. Right, let's see at the manifestation. Alright, skin rash. The Cherokee Banisi compared to the Chironex lacqueri, this is a massive skin rash. Compared to this one, we hardly see a rashes there. Right, but it can cause Irukandji syndrome in a half hour's time. Alright, so the appearance of the rash is not you don't be tricked by the appearance of the rash. Right. Right, Xerodropic, which is a family under box jellyfish. Okay, let's see. Let's see again. The tentacle parts. So we have to remove the tentacle because the tentacle contain the nematocytes. Alright? Which is that can inject venom. Okay, let's see, this is a box jellyfish in the real pictures, not indicator. In Sabah, the locals call it Balomapi. From the, I think this is from the east part of the Sabah. Alright. And then the distribution, we can find the cases, fatality cases in this area. Alright, this is Sempurna, Lahad Datu, Tusandakan, up to Portobello. And alright, so we have a fatality case here in Malaysia, and other countries also, Indonesia, Philippines, Australia, and also there is a cases report in the Thailand, but maybe there is no fatality, right? Most of the incidents occurs within the shallow water, less than 1 meter depth. Alright. So this is one of the example warning information. Alright. If we have a warning system, so we make sure that there is nobody swim during the season. Box jellyfish toxin. Yeah. We go to the second part. The second part is the manifestation. Box jellyfish cause myospastic and neurotoxin. Alright. It affects the ion channels. The manifestation can be varies. Most of the time it's a mild manifestation, but about 15% we have a severe systemic manifestation, alright, which lead to the cardiac dysfunction and respiratory dysfunction. Alright, box jellyfish venom, very rapid development for systemic manifestation. You can see death may possible within minutes. I mean, patient will collapse in the water. Alright. So if the burns is more than 10%, is considered a major and potentially fatal, especially for the children. Alright. For the adults, maybe more than 20%, or adult with comorbidities. Alright? Mean adult having a cardiac or respiratory problem. So 5 to 10% require antivenom. If a patient having a systemic manifestation, most of the time we are giving patient an antivenom. Okay, Chironex species. So we have antivenom for box jellyfish for Chironex species. So the guidelines for systemic involvement, if more than 10%, cardiac manifestation, hyper or hypotension, tachy or arrhythmias, and respiratory dysfunction. For this local, very excruciating pain, severe pain, lasting more than 8 hours, we may consider giving 1 vial of the box jellyfish antivenom. Okay, so we are giving the antivenom. In Malaysia, we have antivenom in Kota Kinabalu, in hospital kanak-kanak, women and child health hospital in Kota Kinabalu. Recently, we also have a store antivenom in Lahad Datu. Alright, in Semenanjung, I don't think we have a stock yet. Maybe next in North region, in Penang, maybe. Alright. So, how many we are giving to the patient according to the manifestation? Is severe, we are giving more. Okay, we can give up to 6 vial. If patient in cardiac arrest, we may consider push 6 vial. Alright, this is indication for box jellyfish. If the patient have a cardiorespiratory problem or excruciating pain, unable to control with the narcotic opioids, and IV Mexaf. Alright, so we are studying the box jellyfish antivenom. Alright, this is the doses that we are give a guide for the clinician to use the antivenom. Yeah. Alright, so the antivenom also comes with a complication, which is acute anaphylaxis. So we treat the anaphylaxis like similar with any other antivenom, a snake antivenom. Alright. The first choice is still adrenaline. Alright. And then the delay one is a delay serum sickness. This depends on the how many we are giving to the patient. If we give more volume, more antivenom to the patient, more potential to have a delay serum sickness. Okay, so can have arthritis 8 to 13 days after that. Okay, next, Irukandji jellyfish, Fabrica banesi. Anybody encounter this in real life? Boleh nampak? You tengok the size. The size is about a coin size, 20 cents. This is, I think, the adult one. Juvenile maybe a smaller, maybe about 5 cents. Right? So a bit difficult to identify in the seawater. The bigger jellyfish also sometimes we miss. This is a very very small jellyfish, Irukandji. Alright. The color is similar with the water. So the problem with Irukandji syndrome is the pain. Excruciating pain, and then it can cause the Irukandji syndrome, which is catecholamine storm. Yeah, everything is faster. Okay, patient mad, angry. All right, BP is increasing, cause acute pulmonary edema. Alright. It also can cause rhabdomyolysis, hypothermia. Alright. If you have a patient with jellyfish that having symptoms, 30 minutes up to usually hours, a few hours, or maybe more than 1 day. Alright. So if you have this patient, we have rated blood pressure, tachycardia, you must suspect of the Irukandji pork jellyfish envenomation. Alright. So, however, we don't have antivenom for this species, and we treat patient according to the symptoms. Alright. For the pain, we give opioids and magnesium sulfate. I think who are from the northern area, northern region? Ada yang daripada northern? Oh, desak seorang je. Alright, I think a few cases reported in Penang, Batu, pulau-pulau, island. So they are giving Maxaffer for the pain, and patient was intubated. Alright. So the example of the manifestation, you can see a MAC patient. Do not refer to psychiatric first. Alright.
Ever the scientist, Jamie analyzes his own pain.
It's starting to come back again. No more pain. It's not a lower back pain or a chest pain. I think it's just complete total pain right throughout the body. Oh dear.
Teresa suffers even worse.
Very
Pain so
painful.
intense, the maximum dose of morphine barely takes the edge off.
No status. I just want everything was clear, was still. Pains from my stomach and I've actually had my arms. It's killing me, both my arms.
Blood pressure can skyrocket. So does your mind. And so does the pain. An endless
You have seen the record.
Stomach hurts. I've got really quite bad lower back pain, like my spine's getting crushed. Pains like up in my diaphragm and just like cramps down in my arms. My arms are killing me.
Like all I can do is on the outside the screen, they're screaming away, which is a bit of a worry. To be honest, I'm more concerned about her than I'm more concerned about myself at this point in time.
Irukandji venom triggers a whole slew of reactions, from pain to cramps to nausea. Because doctors must know what's coming next. Putting a patient under is risky. No single painkiller works for everyone, except time.
Patients may have a nausea and vomiting due to the Irukandji syndrome.
Maybe that's what he's
Alright, this is a study measuring severity. We found out. Alright, 77% stand on toes. Alright, most of patients have a severe pain given opioids, 61%. Alright, and then also there is an incident of death, one death due to intracranial hemorrhage, maybe elevated blood pressure. This is from the Australian report. We have 2 deaths in 2002. Alright. Most of the patients going home, however, about 50% is going to be admitted. We can see there is about less than 1% there. However, still this irukandji can cause death. Alright, so we have pain management for the pain. However, if the pain is unable to control with this agent, you have to consider giving antivenom. Sorry. There is no antivenom for irukandji yet. So just management with painkillers. For nausea vomiting, we give metoclopramide and benzodiazepine for the CNS manifestation to make patient a bit calm, and control the blood pressure with GTN. Alright, this is other examples of the jellyfish. It can cause local pain, erythema, blistering, and rash. It release enzyme. Alright, blue bottle fish or Physalia. It can also cause local manifestation, pain, rash, itchiness. Alright, but however, patient also may have a systemic manifestation, cardiac, or even death incidents a few minutes after being stung. Alright, if the patient having non-systemic involvement, we can treat symptomatically, and with serial observation, maybe about 24 hours. If patient well, we can discharge. Right. So the first aid and the preventive part is the most important. Prevention better than cure, right? So the antivenom a bit expensive for the box jellyfish. So we have a few vial only available. Alright, but we can spread the knowledge on first aid and prevention to make sure that patients that going to the beach are safe. Right. Number one, if patient having a collapse in the water, bring out the patient and check for every breathing and circulation somewhat accordingly. If patient needs CPR, we should start CPR and call for early transfer to the hospital. For the tropical jellyfish, even though there is a controversial in Physalia, we recommend the use of the vinegar. Alright, pour vinegar about 30 seconds to the affected site. Alright, so we can deactivate, we can stabilize the unfired nematocytes. Alright, so this is the knowledge, the first knowledge, the second knowledge after the CPR is the using of vinegar. Alright, so we must make sure that the whole society, the whole public knows about this. Don't put anything else, especially fresh water. Fresh water can trigger the firing. I kencing pun sama though the urine into the affected sites. Alright. The third one is we should teach our public to remove tentacle. You can use the glove or use a tweezer, remove the tentacles, because the nematocyte is embedded in the tentacles. So we remove the tentacles, so we move patient from the danger. Right, sent to hospital immediately. This is there is a video how to get samples. We want to recognize what is the causes of the jellyfish. So we can have a tape to the affected area or to the tentacle and put in the slides, and we can see the nematocysts in the microscope. dia. Alright, notification, prevention, warning, information. If there is a cases, you must notify to the health department, so they can warning the public. So the public health be warning the public on the incidence of jellyfish sting. Alright, and then wear a full body wetsuit when you are going to the beach. Bring vinegar in case there is a stung by a jellyfish. Alright, do and don'ts. Okay, any question on the jellyfish?
No need for irrigation.
Irrigation with the vinegar.
Just the vinegar. So no irrigation with fresh water.
Is there any jellyfish poisoning case due to ingestion of jellyfish?
And so far, I tak pernah encounter poisoning, but as Envenomation.
There are certain jellyfish which is edible. Kalau kita makan jellyfish, kalau kita pergi ke Sabah,